Welcome to the University of Arizona College of Medicine Phoenix Family Medicine Residency Program. We are so happy you're considering our program. We train physicians to thrive in a wide range of practice settings, from rural to urban underserved. Our mission is to elevate health for all through innovative primary care, education, leadership, and community engagement. We provide patient-centered, evidence-based residency training in a multi-residency supportive academic environment. What I love most about this residency is working with our incredible residents and faculty and seeing our graduates go on to do incredible things in leadership and family medicine practice in their communities. I'd love you to meet some of our residents and hear about what they love about our program and also what they love about living in Phoenix.
Welcome to Banner. We're so excited to have you. I'm Kiana. I'm one of the third-year family medicine residents. My favorite thing about working here by far are the people. I love that I have close friends both within my program and within other programs. We're really lucky that we have awesome residents across the board.
I met the residents at this program at the national conference in Kansas City, and they were the only program. When I asked them how was intern year, they're like, it was so much fun. And we ended up dancing and the night away, and I couldn't wait to come here, and I was blown away. I saw the way the residents and the staff got along together. They felt like family. The love was emanating from the room, and I knew I wanted to be a part of that. The other thing is an emphasis on underserved care, and they also have a large refugee population here in Phoenix, which is a community that I'm hoping to work with. So that was a big draw for me.
I chose this program because I was able to rotate here during my fourth year of medical school, and during my time here I realized that this program really cares about patients as a whole, and they're extremely passionate about underserved communities, which is one of my biggest passions.
Specifically, I love the people. Like, that is what drew me to this program, and that's what kept me at this program, and I really do feel like I come to work and work with my best friends every day. The residents and the faculty, over the course of the 3 years, we've actually become friends, which I don't think you can say that at every program. And I really feel like a part of that, the faculty have really prepared me to be my own faculty member, because I'm going back to work at the University of Kansas, where I'm going to do full spectrum medicine, and I really do feel like this program has prepared me for that. I'm going to do inpatient, outpatient, OB, and I do feel really prepared to do all of those things.
Both the residents and the faculty support each other, lift each other up, and enable each other to be the best physicians that we possibly can be. I also really like that the residency prides itself in using evidence-based medicine and critical thinking. Not only utilizing it, but learning how to appreciate it, which sets us up to become not only good residents, but good physicians for later on in our career. I also really like that our program has a mixture of both academic and community medicine. That's something that I think is pretty unique, and you kind of get the best of both worlds.
Yeah, so I chose this program because of how the faculty and the residents treat not only their patients, but treat each other. When I rotated here as a third year, I really felt like it was a big family, and that was really important to me. And then later on in third year, I got to see how the family medicine residents interacted with other specialties, and they treated everybody so well and were treated well in return, which was also really important for me.
I chose U of A Phoenix because I felt a very strong atmosphere for advocacy and diversity. Dr. Brown, who's the program director, was really awesome, and he told me, let's change the world together, so I was really motivated to come here, and that's why.
I think my favorite thing about our program is that I feel like it's a really safe place to learn. I know in medical school for myself, it often felt like that I didn't necessarily know if all my preceptors are in my corner, but here I feel really loved. And as I go on to fellowship, I feel like I have everybody behind me. I know that I came into residency feeling not as confident as I would have liked to, but with the teaching that I've had and the fact that I've been given room to grow and find myself as a physician and a person, I feel really confident going into the next phase of my life, and I really feel like I owe all of that to our faculty and residents.
I chose this program because of its emphasis on serving the underserved, a strong program in an academic medical center, and also the focus on leadership from advocacy, talking to your legislators, and also the AFP podcast.
So I chose Banner U of A Family Medicine Residency program because they share the same vision of improving the health of diverse and underserved populations, which I plan to do in the future.
I chose this program because I knew I would be simultaneously supported by the wonderful faculty and staff that work here, alongside working with the underserved community that I love and grew up in, and because I got to stay close to family.
Our faculty, they're so supportive. They're always willing to find out what our passions are and help us get to where we want to, as a doctor, as a clinician, as a person. I think my co-residents are honestly one of my favorite things. I found my best friends here. You know, people say find your people, and that's cheesy, but you do find your people, and I've definitely found mine.
What do you all like most about living in Phoenix?
I collect rocks, and Arizona is a geological gold mine, literally. So I like to go hiking so I can look for rocks for my collection.
I love to be outside when it's not hot, but when the weather's nice, I love to go hiking. I like to go kayaking, be on the lake, spend time with my dogs, and definitely go out and eat at the delicious restaurants.
A lot of people hate the heat, but I'm not gonna lie, I love it. I'm fine with the 120s. It's not that bad, and plus then that's only 3 months, and then it's beautiful 90s, 80s, so.
I like to eat, so far me and my family have hunted down some really good Mexican food. I love tacos, so I found a couple good spots, and we like to go outdoors and swim because it's so hot out here, so.
I'm a big NBA fan, so as soon as the NBA season gets restarted, I can't wait to go to some Phoenix Suns games.
Plug, whenever you do wards in second and third year, the faculty always take you out to a brunch location, so you'll get very familiar with all of the taco spots in Phoenix.
What I appreciate most about our residency is its willingness to walk the walk of wellness. More than just lip service or a lecture here and there, we fully support our residents' overall well-being and quality of life through building relationships, providing consistent support, protecting time for self-care, and fostering a safe environment in which to explore the complex feelings that emerge in becoming a doctor. Now more than ever, it's important to connect to the humanity that pulled you into this choice of being a healer. I know that can be hard, and we're here to genuinely support you along the way. And you'll get to do it with smart, fun, innovative people who will embrace your ideas and encourage your growth in an environment that challenges us all to realize our best potential. Thank you for considering our program. I hope I'll get to meet you soon.